Recording in progress.
Boa tarde a todos.
Good afternoon, everyone who's watching us now on YouTube and Cofen and Portal da Inovação from the Nursing School of USP Ribeirão Preto and on the Cofen page at Facebook. Welcome. This is our 6th meeting that is part of the cycle of international lectures on advanced nursing practices promoted by PAHO Brazil, the Federal Council of Nurses, and the Collaborative Center for the Development of Research on Nursing from the University of São Paulo, Ribeirão Preto. The purpose of this event is to share international experiences in order to have basis for a discussion about the practice of the advanced nursing in Brazil. So to begin our event, we pass the floor to Mônica Durães, the National Consultant of the Technical Unit of Human Capacities for the Pan-American Society of Brazil, PAHO Brazil. Good afternoon, everyone. Thank you very much for this opportunity to be together today and another meeting on this theme that is so important and challenging for our healthcare system, which is to expand the practices of nursing in Brazil. This is our last meeting on behalf of PAHO Brazil. I'd like to thank everyone, all of the partner institutions, especially our lecturers today, who are going to bring their contribution from the UK. We have a lot of challenges to face, and this meeting opens up a path so that the theme becomes a reality and we can understand the possibilities of construction based on successful experiences. This group of 6 meetings that we had showed possibilities to identify factors that will allow Brazil to have a proposition that is advanced. The idea is to advance toward contributing to a national healthcare system that is stronger, acknowledging the importance of nurses that can help to keep our population with the utmost quality. So I'd like to thank all of the participants who have been with us during this entire time. And I'd also like to thank the team that has been with us, giving us a lot of support in the organization of this event, and to say that from now on, we have our work with our partner institutions in order to build a proposition that's going to be discussed with all of you. So thank you very much. And to the participants who are watching us, if you have any questions, you can ask away on the chat. And so a wonderful conference to all of us. Thank you very much. So now I'd like to invite Dr. Manuel Vieira de Miranda Neto, a member of the Advanced Nursing Practices Commission of the Federal Nursing Council. He's representing Dr. Betânia Maria dos Santos, the president of Cofen. Hi, good afternoon, everyone. Good afternoon to all the nurses of Brazil. It's with great joy that we meet again today in our last session of this cycle of lectures so that we can get to know new opportunities for implementation, new advanced roles for nurses. But this is the start of a long path that we will take. So I'd like to thank the Pan-American Health Organization and the Collaborative Center of Nurses from the Universidade, Ribeirão Preto, and also the partner institutions and National Council of Healthcare Nurses that have also worked with us very closely on in these discussions, and all the other actors who need to be involved in our path to discuss the advance of nursing and in particular the possibility of developing advanced roles for nurses. So along these 6 meetings, we had the opportunity of getting to know the experiences, the rights and wrongs, the challenges, and especially the future challenges that a series of countries that are already acknowledged for their advanced roles and for the existence of advanced nurses. They have been working with that for a long time. And so we can get to know the experience from Chile, Canada, the United States, Spain, Mexico. And today we will hear from the UK, which has a healthcare system that is acknowledged for its excellence. And we can also get to know the group within the International Council of Nurses that gathers nurses, advanced practice nurses, and is organized in a perspective of networking, of meeting and gathering with professionals so that they can support the roles. So I'd like to thank them very much. And once again, I'd like to invite on behalf of the Federal Council of Nurses, I'd like to invite everyone, all the strategic actors who acknowledge within the advanced nursing practices a path and a perspective to strengthen the healthcare system, to expand the access to healthcare systems, and to strengthen this system. So the nurses, with more than 2.5 million professionals in Brazil, for sure can benefit from the healthcare system and can benefit everyone as well, for individuals and Brazilian citizens. Thank you very much. And I am sure that we will have a lot of other meetings to discuss how we will do all of those things and what will be our challenges to implement these rules. Thank you very much. Ana, I think you are muted. Sorry. So now I'd like to invite Dr. Carla Ventura from the Ribeirão Preto School, Nursing School, representing Dr. Maria Helena Marziali, who's the director of the same school, to say a few words. Thank you very much, Ana. Good afternoon, everyone. On behalf of Professor Dr. Maria Helena Marziali, the director of the Nursing School of Ribeirão Preto from the University of São Paulo, which is a collaborative center of the PAHO and the World Health Organization for the research on nursing. I'd like to greet Dr. Mônica Durães, Dr. Manuel Vieira de Miranda Neto, who are on this opening panel. And I say that it's a great honor to be here on this last day of our cycle of international lectures about advanced nursing practices. This cycle has been a wonderful opportunity to talk, to interact, to discuss experiences from 6 different countries, the ones that Dr. Manuel just mentioned, about the possibilities to implement the advanced nursing practice in Brazil. I take this opportunity to thank all of our partners and members of the group in this discussion, in particular Cofen and PAHO, that have been with us through all of this time. I'd also like to thank our guests today who accepted the invitation to share with us their experiences and perspectives about the advanced nursing practice. So I'd like to wish you all a wonderful conference. Thank you very much. I take this opportunity then to thank once again our important partners who are members of the group, the discussion group on advanced nursing practices. Those are ABEM, CONASEMS, CONAS, the Health Ministry of Brazil, the Ministry of Education, the University of Brasilia, among others. So to continue now, we would like to thank our guests today for having accepted our invitation and share their experiences about advanced nursing practices in the UK. So to begin our lecture, I will introduce our guests very briefly, talking about their work. Dr. Melanie Rogers is a professor of the Nursing and Obstetrician Department of the Human Sciences and Health School and member of the Applied Research Center on Health. She began working at the university in 1998, and she's currently the leader of a course and a senior professor of the Health and Rehabilitation Division. She's also an advanced nurse in primary health. She completed her PhD in 2015, defending the hermeneutic investigation on spiritual dimensions of the consultations of advanced nurses by means of an outlook for the availability and the vulnerability. She's the founder and president of the Spirituality in Healthcare Group and Social Assistance from the Huddersfield University, in addition to being a member of the committee of a network of studies on the British Association of Spiritualist Studies. She has worked with teens and universities doing a lot of research, among them, about advanced practice nurses and how they can make up teams for the clinical practice. She was the chair and founder of the Yorkshire Nurses Forum that had more than 150 members in all of the area, and worked on the continuous professional development and opportunities for networking for nurses, for advanced practice nurses for 16 years. She was a member of the Committee of Educators Association for Advanced Practices, and she works on promoting the role of advanced practitioners in primary education. Her areas of interest are health, mental health, the health of women, advanced practice, spirituality, and education. She has collaborated internationally for the research on satisfaction of nurses in developed and developing countries. She's currently nationally involved in a research project for about results of learning with 5 universities, and she's also the chair of the subgroup of advanced practice nurses of the International Council of Nurses. And also today, we will have Dr. Daniela Lehwaldt from the primary department of the nursing school, psychotherapy and community health. Dr. Daniela is part of the academic body of general nursing with a master's in nursing and practices on healthcare. As an academic leader in nursing, she works to prepare a strategic vision and develop the academic discipline, including education, research, and professional practice. Her role is also to contribute to the leadership, management, and administration of the school, and leadership activities for professors and universities and students. She also works in undergraduate and graduate programs on nursing, and she has certainly centered her work on international curriculum in projects like improved communication in nursing by means of the exchange of experiences of clinical teachings and assessment for nurses and healthcare educators. Her research interests are on education for nurses, clinical decision-making, and advanced nursing practices. Her involvement in conferences, publications, and projects makes Dr. Daniela occupy leadership positions in prestigious bodies, including the Advanced Nursing Practice Network of the International Council for Nurses and the European Society for Cardiology. She is currently the vice president of the Central Orientation Group of the Network for the International Council of Nurses that deals with advanced practice nurses, and she's also a member of the Education Committee of the Cardiovascular Nurses Association and of the European Council for Education and Education of Nurses of the New Network, and academic member of the Irish Association for Advanced Nurses. So Dr. Melanie and Dr. Daniela, I pass the floor to you so that you can share your experiences about advanced nursing practice on the UK. Thank you very much for being with us. I'm sure that our afternoon will be very good, and we will have great moments together.
Thank you so much, and hola and boa tarde. That is as much as my Portuguese, but I hope that if I speak slowly, the interpreters will be able to keep up. Please do tell us if we speak too fast, because in the UK, we do tend to try and keep talking, so please feel free to stop us at any point. Thank you very much from PAHO and the WHO Collaborating Centre for Nursing Research and Development. We are absolutely delighted to be able to speak to you today, and we send all our best wishes to all of you and all of the nurses watching on social media. So I'm going to start the presentation and then I'm going to hand over to Daniela. And although we're going to be having a look at the UK, we're also going to be looking at our close neighbour and friends in Ireland, so we can give you a little bit of a flavour about what is going on in practice. Do you want to say anything, Daniela, before we kick off?
Oh, that's perfectly fine. Thanks very much. You can start off and I'll come in later.
Great. So we're going to talk today about some of the global developments of advanced practice nursing. We're going to give you some case studies about what happened in the United Kingdom and also about what is happening in Ireland. And hopefully, the more that you hear about advanced practice, the more excited you will be about the input and the change that advanced practice nursing can bring in terms of meeting the needs of our patients. As Anna said, my name is Professor Melanie Rogers. I'm based at the University of Huddersfield, and I'm a nurse practitioner in primary care. I still work clinically, and I also run the course for advanced practice. I have recently finished my chairmanship of the International Council of Nursing Advanced Practice Nurse Practitioner Network, and Daniela is the new chair. And I have changed roles to be the director of the Academy for Global Research and Enterprise. So, why do we need advanced practice nurses? We all know that we are facing a pandemic, not just of COVID, but of non-communicable diseases. We know that they kill over 41 million people a year, relating to 71% of the global deaths. We know that many of these deaths occur in low to middle income countries, and for all of us, NCDs are increasing. Just so you have some idea about some of the statistics, so cardiovascular disease leads to around 18 million deaths per year. Cancers, 9.5. Respiratory disease, 4.1. Diabetes, 1.5. And over 970 million people have a mental health or substance misuse problem. And as we've all faced the trials and challenges of COVID, I can guarantee that our next pandemic is going to be mental health, and we really need to put in the support and care for the patients that we see. In terms of communicable diseases, over 1.8 billion people are still infected with TB, leading to at least 1.2 million deaths. We still have 37 million people living with HIV. 1.5 million children are dying of diarrhea. 4 million deaths of pneumonia. And as at the moment, over 4.3 million deaths for COVID. So advanced practice nurses, we are here to meet the challenges of universal healthcare quest. We want to improve healthcare. We want to make sure there are better healthcare outcomes, better access for all of our patients, whether they're in rural or suburban areas. We want to improve efficiency, and fundamentally, we want to give patients a much better experience. And as a nurse, I am passionate about the implementation of holistic care. And throughout my advanced practice training, I strive to bring together the best of nursing with the best of medicine to offer our patients that unique experience of holistic care, that they don't have to go to a number of practitioners. They can come to what we would call in England a one-stop shop, where we're able to assess, diagnose, treat, and manage, obviously within our limitations and often working within a team, but we can be that provider for our patients. It's well recognized by WHO and the UN, the global health challenges, and we all want to try and attain universal health coverage by 2030. We have the goals that we need to meet, and advanced practice nurses are center stage for meeting these. Health is our human right, and it's the challenge that is set before each of us. We still have over 400 million people globally who lack access to one or more essential services. We have over 100 million people falling into poverty, trying to pay for essential healthcare each year. 32% of each country's health expenditure comes from out-of-pocket payments, and still over 40% of the world's population lacks social protection. So universal health coverage and sustainable development goals provide the overarching objectives for our global strategic planning. They are a clarion call to all of us to strengthen our health systems, to establish new models of care. And I fully believe that by building advanced practice nurse capacity and recognizing what advanced practice nurses can provide in terms of healthcare in all populations and all settings, by ensuring that we work at our maximum scope of practice, we can make a significant impact on universal health coverage and sustainable development goals. So how can we do that? Advanced practice nurses are leaders, and they're often leaders in a multidisciplinary team. They bring innovative models of care. They're able to work autonomously and adaptably. And fundamentally, they are patient-focused. They offer collaboration and mentoring of colleagues across the organizations. And the APNs that I've had the pleasure to work with internationally create a vision and empower and engage others. They're helping to move the shift to population health management, wellness, and addressing the social determinants of health. They're working hard at prevention and the overall holistic health of population, and they make every opportunity count. For example, I might see somebody in clinical practice with an acute problem, but I'll also address preventable health problems and look at social needs as well. We offer increased access to care and provide care across the continuum. We have helped to move a big shift from hospital to community practice, and we bring quality and value to healthcare, and we have been shown to increase patient satisfaction and to not increase the costs, and we provide that integrated package of care. So bringing APNs into the Brazilian nursing force, you're going to have those highly skilled and educated nurses who provide high quality care, high patient satisfaction, and we increase our career progression for nurses. So what stops advanced practice nurses achieving their potential? And this is what we've found globally. So countries that haven't been able to establish clear guidelines for the role, countries who have not put in legislation and regulation, countries that haven't been able to provide the necessary educational frameworks, countries that haven't had adequate funding to develop these roles, and have not ensured that nurses that have gone through programs have job opportunities for progression. And then there are some of the challenges around medical or other healthcare professional resistance. There is enough need in our patient population to have many, many different roles. We're not in competition. We are here to bring together the best possible care for our patients. Now I'm going to hand over to Daniela, who's going to tell you about our work to develop advanced practice guidelines to bring clarity and tell you about our international network.
Thanks very much, Melanie. Yeah, so just to say thank you as well for inviting us here today. I'm really happy to be here today and to have the chance to present to you and hopefully to get into some communication later. I'm really looking forward to your questions. So please do leave them in the chat. Be more than happy to try and answer them later on. As I was already introduced, I won't say very much. My name is Daniela Lehwaldt. I'm originally from Germany, where I trained and worked as an intensive care nurse. And I went to Ireland in 1999, a long time ago, and I worked there as a nurse practitioner in cardiothoracic surgery for a while before I went to the university where I teach now. And I have always stayed very close to advanced practice nursing as a passion of mine. And I'm also coordinating the master's program now, where we produce clinical nurse specialists, which is one type of advanced practice nurse. And I come to that when I talk about the International Council of Nurses guidelines now. So within the network, we have been part of the ICN for quite a while. We're really happy about that. And we can, within the ICN, we can, I suppose, input into reports and guidelines and research and so on. And this year is the guidelines for advanced practice nursing. And there has been a definition already around since 2002 that was revised in 2008. But we got a lot of feedback that it was just like almost like a one-pager, so it was very short. And this document is about 40 pages long. It's available in 3 languages, in Spanish, in French, and in English. And the link is there at the bottom of the slide. And the guidelines really are much more comprehensive. So if you're not really sure what advanced practice nursing really is, please do read it, because it will probably answer a lot of your questions. So the objective of the guidelines are to contribute, or is to contribute to a more common understanding globally, because advanced practice nursing, as you know, doesn't exist everywhere just yet. So it's just to help along with, finding out what it actually is, how it is defined, describe the pillars of advanced practice nursing. And we did incorporate international feedback from experts around the globe from 33 countries. We as a group, ICN and the network, were drafting the guidelines, and then we got feedback from the experts around the globe from 33 different countries. And we also sent out, when we had a formal draft based on the feedback, we sent it out to all of the ICN 130 National Nurses Associations for comments as well. So it's a very comprehensive document, we hope, that helps to clarify, what advanced practice nursing actually is. It took us about 2 years, and there's a paper that's on the slide there as well that was published on that if you want to know more about the methodology. That's the paper there, developing a consistent approach to advanced practice nursing worldwide. It's the paper there on the left side. Thanks very much. Sorry, Melanie. Next slide, please. Thank you. So one of the things, as I was saying, if you're not sure what it is, so it clarifies the terms. You may have heard all sorts of things, advanced nursing practice and advanced practice nursing. What does all of that mean, really? So this is part of the guidelines, and to clarify that understanding. So what we came up with, I suppose, by consulting globally with all these different experts, is that advanced practice nursing is an umbrella term, so an overarching term that describes the nurses who are usually experienced nurses who want to stay in clinical practice. They don't want to be a teacher. They don't want to be a manager. They want to stay in patient care. So it's giving that nurse the opportunity to work in a dedicated role that actually lets them do that. And they can work generally, I suppose there's many, many different titles around the world, but the 2 most common ones we have identified in the guidelines are a clinical nurse specialist, is the CNS, who provides expert clinical advice and care based on established diagnosis, so patients who already have a diagnosis in specialized clinical fields. And they also use a systems approach in practicing as a member of the healthcare team. So they might be very much involved in helping the teams, the nursing teams, the medical teams perhaps, to gain knowledge in an expert area. So an example could be a tissue viability nurse. Is a nurse who has a specific knowledge in an area, and she can also provide care, but she can also hand on the knowledge in a hospital-based system or in a community-based system, for example. A nurse practitioner is the other most common role, and nurse practitioners are the ones who really bridge the gap between nursing and medicine. So this is a role where you're crossing over into medicine. That needs to be crystal clear in people's minds. So a nurse practitioner uses the clinical skills associated with nursing and medicine in order to assess, diagnose, and treat patients. And that's in various settings. So they see patients that maybe haven't been diagnosed yet. They assess them, they diagnose them, they treat them, and they provide care. So they're really crossing over between nursing and medicine, and have, as Melanie was saying, this autonomy and authority to do so legally and within the system. So they're the two most common roles. There are other ones as well, but these are the two you will find in the guidelines. Next slide, please. Sorry. So one of the things that we clarified within the guidelines is very important is, so what, these steps, so the career pathway. So I'm a clinical nurse, I'm a generalist nurse, I'm a staff nurse on the ward. We assume in the guidelines that you would have some form of a diploma or bachelor degree when you start off as a general nurse. The next step, if you want to stay in clinical practice, might be that you become a specialized nurse. And a specialized nurse is a nurse who works at the same level, really, as a generalist nurse, but in a specialized area, maybe in an intensive care unit, in the operating theater, in palliative care, gerontology, dementia, or any kind of area like that. And they might have done a specialist course. They usually are very experienced, very knowledgeable nurses in the area. But then you might want to become an advanced practice nurse. So that's again in the level kind of thinking, that's another step up. So these are nurses who have a master's degree, and nurse practitioners also have a master's degree. That's the entry criteria for advanced practice nursing that we're proposing in the guidelines globally. And the master's degree program, and that is really important, has to be a special master's program for advanced practice nursing. So the program needs to prepare that particular nurse or all of these nurses to work as an advanced practice nurse. So they have to have clinical skills that are more advanced than a general nurse or a specialist nurse. So they have to be able maybe to prescribe medication. They have to be able to assess the patient practice, as I say. They have to be able to diagnose. They have to be able to treat the patient. They have to be able to order tests. So they have to be able to do all these things, and they learn them during the course. That's why they need a master's degree on top of their normal training that they have done maybe many years before that. We recommend about 500 hours of clinical supervision as a minimum within that master's program, and that is based on a paper that is there also on the screen now, where we have compared 5 countries that run these courses already for a while. So that's just about the education, the stepping up process, and that it's part of the APN pillars, which you will also find in the guidelines. So education, as I said, has to be beyond the level of a generalist or specialist nurse. A minimum requirement is a master's degree in a specific program that prepares the nurse to be an advanced practice nurse. So it has to have significant amount of clinical advanced skills. It is acknowledged in the guidelines that not all countries can just switch like that. So sometimes we need to bridge the gaps, and that's absolutely fine. It might be an aspirational goal, and we need to give countries the time to get there, and that's absolutely fine and absolutely acknowledged. There has to be regulation, and that is crucially important in order to make this role work over a long period of time, so to be sustainable. Advanced practice nurses have to have the authority to diagnose, prescribe medication, order diagnostic tests and treatments. They have to be able to admit a patient, refer a patient, discharge a patient. They have to be able to do all of these things, and their title, advanced practice nurse, clinical nurse specialist, or advanced nurse practitioner, has to be protected within their country. And that will also have an impact on their salary usually. So that's very important. Practice, it is an advanced practice nurse. So as I said, it is for nurses who want to be in practice and continue to be in practice. So it's a designated role, a specific level of nursing practice. So from staff nurse to specialist nurse to advanced practice nurse, who focus on the provision of care, illness prevention and cure beyond the scope of practice of a generalist or specialist nurse. They have an extended, broader range of autonomy. They have higher decision-making skills, and they carry out advanced assessment, judgment, decision-making, and diagnostic reasoning. So it's really important. Basically, the point is to provide timely and safe care to patients. So if I work as an advanced practice nurse in an intensive care unit outreach nurse, where I might be a nurse who can go onto a normal ward to see the patients who are critically ill, and I have higher decision-making skills. If a patient gets seriously sick, I, as a nurse, can decide, as an advanced practice nurse, I have the authority to say that patient is not good, that patient has to go to ICU now. It doesn't have to wait until the doctor comes. We don't have to make 10 phone calls. That patient goes now back to ICU because we have made a clear assessment and the patient been diagnosed to be very critical right now. So that is the level of advanced practice nursing. So it's a different level of nursing care, just to kind of clarify that with an example, I suppose. Next slide, please. So an emergent pillar is also research. This is important to mention that as well, and that's in the guidelines as well. Advanced practice nurses do have to have the ability to integrate research into their own practice, to make it current and to make it contemporary and safe, but they also generate new knowledge because they work in very new and upcoming areas, and they have very interesting fields of advanced practice nursing research. So you will find that, and that's part of what the network is producing a lot of the time, to share that with our members. Next slide, please. Yes, so the International Council of Nurses, Nurse Practitioner and Advanced Practice Nurse Network that Melanie and myself are part of are led by the core steering group, who are basically the management board. Just a little bit about the network here now. And we have developed the first global academy of research and enterprise that Melanie is chairing, and that's going since 2020. We do have members from 121 countries globally. That's on the map there on the right. Everything that is marked in red is where we have members, individual members from the countries. As you may know, and as you see from the picture there or from the map there, advanced practice nursing is, depending on where you are in which country, is a developing concept or a developing model of care that is there. So in some countries that you might find yourself in, it's very established. It's there, and you may have heard that in one of your previous lectures already. And then some other countries that you might find yourself in, it's a developing model of care. And in some other countries, it doesn't exist just yet. So it's developing overall, and that's what we do as a network. We're supporting this development, and we're looking, we're helping to implement and evaluate the role. We have 5 subgroups: education, practice, research, health policy, and the student subgroup. So all of those groups are really important for us. So the network provides global leadership on advanced practice nursing to strengthen health systems and assist in the development, recognition, implementation of advanced practice nursing roles. And the link to ICN is very important there because it does give us a global voice. The primary goal of the network is to become an international resource for advanced practice nurses and others who are interested. We don't exclude. If you're an educator, if you're a policy decision maker, a health planner, researcher, or an educator, we need all of those people on board. So we're very happy to have representation from all of these groups within the network, and also practitioners themselves. We provide relevant and timely information about practice, education, role development, research, policy, and regulatory developments. And really, we are a forum, and that's really important, I think, for sharing and exchanging knowledge across the globe. So that's really why I think a lot of people, come to us to network and see what's happening everywhere else, and develop a vision of what can be done in your own country. That's very important. We support nurses and countries who are in the process of introducing the developing APN rules and practices, and we provide access to international resources. And certainly we have plenty of projects going on. So within the network, we have a proven track record of delivering successful programs of work, research, policy, and regulation that connects individuals across the world. So we have been around since the mid-1990s. We continue to support the work of the International Council of Nurses and their missions. And the network has some of the most experienced clinicians in the world And as such, we harness the capability to influence global health policy under the auspices of the ICN. So it's really important, as I said, to have the link. We are harnessing the skills, the abilities of our members to lead the development of advanced practice nursing, and we aim to support the strengthening of health systems through the policies and some of the products, and increasing the capacity and capability of advanced practice nurses. And we're building a scientific body, and we're doing a lot in terms of projects and trying to build, generate knowledge to positively influence the developments and patient outcomes related to advanced practice nursing. So our mission, I suppose, within the network is to empower, to connect, and to promote advanced practice nurses globally through network policy development, advocacy, leadership, education, and research. So you see here the main kind of words. You know, we're passionate. We all have a day job. We're all doing this on the side. None of us are getting paid. We are just passionate about what we're doing and what we're standing for. So that is something that's really important to know when you think about the network. We are collaborative. We work together with the ICN. We work together with all of our members. We're global, and we're evidence-based in terms of producing projects and research, and also and also using it. And we have research and innovation focused particularly now with the academy. And Melanie, if you want to come in to say something, do feel free to do so.
Thank you, Daniela. So I'm just going to talk a little bit about the Academy, and then I'll hand back to Daniela to talk to you about what's going on in Ireland, and I'll come back and talk to you about what's going on in the United Kingdom. So we are delighted to have been involved with the network probably for the last 15 to 20 years. And Daniela and I have been working together closely we worked together on the practice subgroup before becoming the chair and deputy chair of the network. And over the last 5 years, we have grown substantially. As Daniela said, we now have members in 121 countries. And we felt that the projects that we were becoming involved with were certainly gaining momentum. They had lots of collaborative partners. So we brought together the ICN Nurse Practitioner Advanced Practice Nurse Network, Global Academy of Research and Enterprise, to really oversee those large projects. So just to give you a flavour of some of the projects that the network and the Academy have been involved in. So currently, a number of collaborators are involved in a very large study looking at advanced practice nurse, emotional and spiritual well-being and resilience through COVID. We gathered over 1,500 responses last year, and we've now got that study in its second phase. And unsurprisingly, you will recognise that many of our advanced practice nurses and nurses have had significant impact on their well-being and resilience. So we want to put in some support packages to develop resilience for advanced practice nurses. We have a very large global SWOT analysis looking at advanced practice, education and regulation. We have competency mapping across 19 countries. We have APN studies on regulation as well. And we've been very much involved in developing advanced practice nursing in a number of countries in Africa through the Anglo-African Advanced Practice Nurse Coalition. We have done work on advanced practice nurse job satisfaction, and we've set up mentoring for countries who haven't had the role. And one of our pioneer countries in the last few years was Hungary. So if there's colleagues in Brazil who would like us to support you, we'd be delighted to do so. So what we're planning to do in terms of the Academy is continue to do our work around wellbeing and resilience. We've now expanded our work in Africa to look at the Francophone and Lusophone countries as well. And we're looking at developing more advanced practice in more countries in Africa. We're currently undertaking a very large systematic review, looking at what the global gaps are in terms of APN research. We've just launched a study looking at advanced practice nurses' perceptions of spirituality, and Next year, we'll be launching a series of webinars on a number of topics, as well as developing APN education through CPD standards. And we have country profiles and APN roles on our websites that we will be developing. You are more than welcome to join us. It is a free organization and the website is on there. We also have social media and we have a new website coming soon. And Daniela's based in Dublin. I'm sure we'll say more about this, but she would be delighted if you came to Dublin for our next conference, which is in August 2022. And we're hoping that this will be a face-to-face as well as a hybrid role. So a little bit about what's going on in England. So a bit of background. We were asked some questions which we're going to respond to, and we'll happily take questions about it. So why did we develop advanced practice nursing? So fundamentally, we've had changing needs in our population. We are struggling to offer healthcare to our population in all areas, and we've had a massive shortage of healthcare and medical provision. When we were in the European Union, we had a directive to reduce the hours of junior doctors, so we had a real gap there in terms of the provision we could provide, and we've had a desire to advance nursing. So this document here really lays out where we're going in terms of the United Kingdom. So advanced practice nursing isn't a term we use in the United Kingdom. We have historically used the term nurse practitioner or advanced nurse practitioner, and we're now moving to the title advanced clinical practitioner, and I'll explain to you why. So in the UK, clinical nurse specialists have been developing since the 1970s, but are not always at an advanced level. Sometimes they are at a specialist level. In the late 80s, we started with our nurse practitioner in primary care, and that was initially at diploma level, then moved to BSc and is now at master's level. In the early 2000s, we started to roll out the nurse practitioner programs into secondary care. And in 2008, our National Health Service brought together an advanced practice toolkit, which many of our colleagues then used to develop advanced practice. We had guidance from our Royal College of Nursing, which is a union and a professional organisation. But in 2015, there was a real push to also train other allied health professionals in terms of advanced practice. So we had paramedics, pharmacists, OTs becoming advanced clinical practitioners by undertaking the original nurse practitioner training. The UK has not done this well. As we talked about earlier, you should credential and legislate first. We didn't do that. So in 2017, we had a voluntary credentialing for nurses, and now we're looking at accrediting all our advanced practitioners through a centre of advanced practice. So the challenges that we face during implementation and continue to face are the issue that we had with lack of title protection. So you might have seen a study by a colleague in the UK, Dr. Alison Leary, who looked at titles and found that we had over 517 titles in the UK. We didn't regulate and we didn't ensure role clarity. There was initial resistance to change. However, the role is fully integrated in all areas of practice now in the United Kingdom. There are some areas where there was organisational constraints, where advanced nurse practitioners weren't able to work at their full level of practice. That has been amended now, and most advanced practitioners can work at their full scope. We had challenges with prescriptive authority, but we had independent prescribing in 2006. So some of the issues we still have are the inability to sign sick notes and sometimes lack of support. So in terms of definitions for our country, in 2012, we moved the title from nurse practitioner to advanced, hoping to identify the more advanced nature of the role. In 2015, we moved to the title advanced clinical practitioner, and our government states the advanced clinical practitioner or advanced practice is delivered by experienced registered health and care practitioners. And they suggest it's a level of practice characterized by a high degree of autonomy and complex decision-making, and similar to the ICN, that they say that this should be underpinned by master's level. In the United Kingdom, we have the 4 pillars, that is clinical practice, leadership, and management, education and research. And many of our ACPs work within the main pillar of clinical practice as their largest pillar, but continue to work on the other pillars as well within their competence. And advanced clinical practice embodies the ability to manage clinical care in partnership with individuals, families and carers, and it includes the analysis and synthesis of complex problems in a range of settings, enabling innovative solutions to enhance our patients' experience and improve conditions. So I've just put a slide on here in terms of the difference between advanced practice nurses and generic nurses. So really we're thinking about the scope of practice, the ability to have that critical thinking and be accountable and autonomous in those clinical decision makings, obviously the qualification at master's level in a defined advanced practice course, the prescriptive authority and the leadership qualities, and our salaries are better, although they're not very good in comparison to things like business. And in terms of the difference between an APN and a doctor's, really is the difference in philosophical focus. So we focus on care. There is often a difference in terms of educational structure. The timeline to practice is often different, and the regulation, the salary and the career outlook. So just a little bit about our training and curriculum. So we have a Masters of Science, and in the United Kingdom, we often have something called an apprenticeship, which the government uses as a funding stream whereby tax paid by healthcare facilities is put under a levy so they can train students without having to pay additional charges. They have a minimum of 500 hours in clinical practice with an educator, and they have training in pathophysiology, decision-making, assessment, history taking, physical examination, management, leadership and education. It is a 3 years course which has contemporary advanced practice looking at education, leadership and research, core clinical competencies looking at all of the core body systems, prescribing. We have in our second year a specialty module. So in United Kingdom, we have modules on primary care, secondary care, cancer care, mental health, emergency care, critical care and pediatrics. And we have a dissertation and an endpoint national examination now. So in terms of our growth, we've had an 8.2 growth over the last few years. We still don't have legal regulation, although, as I said, in order to work as an advanced practice nurse, you do need to be a prescriber, you do need to be a registered professional and hold a master's degree. And our advanced practitioners are working all across the country in many specialties. They are fully autonomous in primary care. They often have shared autonomy in secondary care. In order for them to perform their activities to care, do they need supervision? So clinical education is required throughout their training, but on qualification, they can work autonomously. And in terms of a career pathway, we have a robust career pathway through our organisations and Health Education England. And how are we paid? So salaries start at something called a grade 7 in the UK, which you can see there, which is around £38,000, and they move to a grade 8 on qualification at 45,000. So just to finish off very briefly, I run weekly clinics, seeing about 15 to 20 patients per day. I have 10 minutes, which certainly isn't adequate, is the way our primary care system works. And I see all comings. I see presentations ranging from the simple to complex. And typical presentations would include contraception, mental health, infections, long-term conditions, accidents, cancers, serious pathologies. And I work within a biopsychosocial approach. So I'm going to hand back to Daniela to tell you about Ireland. And I've just noticed it's not on this slide. So just bear with me a second while I pull up the Irish slides, which seem to have disappeared. Otherwise, I'm hoping that Daniela has them.
I do hope so. I have not prepared for that, but I can already, while you're looking for this, I can already just explain that although we are geographically very close to each other, the UK and Ireland, the Irish healthcare system is completely different. And the regulation and the education and so on for nursing is also, you know, just I guess independent of the UK. So it's really like everything that happened with regards to advanced practice nursing happened, I suppose, just within that kind of context of the Republic of Ireland, of what I am talking about right now. Thank you very much. That's perfect. That's just me there, advanced practice nursing development in Ireland. So the background for us, so how did advanced practice nursing implementation start in Ireland? So in Ireland, actually, it was really a bottom-up approach, and I think that's important to understand. Quite often the legislation, and if you even look at what Melanie said, you know, title protection might come much later than the actual role. And so sometimes, you know, there's no need to wait for these things, because what happens in reality is that the posts are developed from practice. They're developed by nurses who have lots of experience, who want to stay in patient care, and who are passionate about what they do. And our, I guess, first accredited advanced nurse practitioner, is what they called in Ireland, is Valerie Small. So she was in 2001 the first person who had fought for her role to be an emergency care nurse practitioner, to look after patients who have non-life-threatening and non-limb threatening emergencies. And she would be trained under the supervision of a medical consultant to become a nurse who can by herself and independently look after these patients from coming into the emergency department to either walking back out or being referred to on the ward. And 1998 was a really important time before that in our history in Ireland. It was the first time where nurses kind of started to come together and ask for better working conditions. And the Commission on Nursing report is where it's clearly actually laid out for the first time in Irish history to say that there should be a clinical career pathway for nurses, from staff nurse to clinical nurse specialist to advanced nurse practitioner. And that is actually written in the Commission on Nursing report. It's a very important report in that regard. And we had a national nurses strike shortly, or more or less in conjunction for that, where nurses like Valerie Small and others were fighting for these clinical career pathways. And that was one of the things. There were other things within the nursing strike that nurses were fighting for, but also for a clinical career pathway. That was one of the things that was important at the time. And with that, also the change in nurse education to structure of a bachelor degree to master's degree and a PhD or doctorate level. And obviously, as we saw earlier on, the master's is important for advanced practice nursing. So what were the main challenges faced during the implementation phase, or what are we still experiencing? I would say nursing is really, I don't know how it is in your country, to be honest, but in where I'm from Germany and I've been in Ireland, I guess that's the two countries that I know best. Nursing can be quite hard to deal with sometimes. So as nurses, we're sometimes not very nice to each other. And when I was starting to work as a nurse practitioner, my nursing colleagues were probably, you know, giving me the hardest time. I was coming from intensive care to work as a nurse practitioner, and it was quite hard at the beginning. But that is just, if you face that, it will go away. You know, you have to just keep working with that. And it's something that develops over time, that there will be an acceptance from within nursing and also from the medical team, which I didn't find that hard at the time when I was doing it, but there might be different experiences. The pay scales, as I was saying, this rule in Ireland certainly developed from the bottom up. So the pay scales came later. They are there now, but they weren't there at the beginning. So nurses had to work at an advanced level for the same pay as everyone else, and that was quite hard. Prescriptive authority, also something that came later. So the post, as I said, the first accredited post was available in 2001, but the legislation for prescriptive authority only came in 2007. So that's how long that took to get that through. And there's currently a lack of the clinical nurse specialist title protection at the nursing board level. NMBI is the Nursing and Midwifery Board of Ireland. So at the moment, the clinical nurse specialist title protection is managed through the office of the Nursing and Midwifery Service Director, which is not the official regulator as such. So we're hoping to bring that back to the right level, but somewhere within the development, it had gotten lost. The nurse practitioners are regulated and the clinical nurse specialist title is not fully protected at the moment. So that's a problem. So the definition of advanced practice nursing, is there a definition? And for advanced practice nursing in your country, and also to support the training of the professionals. And I have to say within Ireland that we have a lot on that. Ireland is very well regulated in nursing in general, and also in advanced practice nursing. You can see here, we have a framework for the establishment of advanced nurse practitioner posts. We have a framework for establishing clinical nurse specialist posts. And basically you pick that document up and you go step by step through it as to how you can organize this within your own service. And usually it's a nurse who wants to become an advanced nurse practitioner, the nurse manager, and a consultant who will work together as a team to build up that post. And it needs to be then accredited by the nursing board. And the nursing board also provides a national framework, which is, I don't know many countries who have that. There's a national framework with standards and requirements for the master's program for advanced practice nursing. So we have actually, if you train in Ireland to become an advanced practice nurse, you will be trained by a national standard. So everybody has a minimum standard that is kind of guided by the nursing board. So politically, nursing in Ireland is very strong. We have a chief nursing officer. We have 4 assistant chief nursing officers. We have a strong nursing board. So nurses, nurse regulation, I suppose in general, and the definition and training is very strong. We have documents for everything, really. Next slide, please. So what's the difference between advanced practice nurses and a generalist nurse? So the advanced practice nurse is working in a dedicated role, carrying out advanced nursing practice. I was kind of saying that already earlier on a little bit. So really what that means, I suppose, is that not every nurse will either want to nor have to work at an advanced practice nursing level. So it's usually about 2% of the workforce. So I would have to calculate that, and my math is not great. So you said you have 2.5 million nurses in total. So only a small proportion of that would actually want or can actually work in an advanced practice nursing role. But there will be a lot of generalist nurses, and there will be a small percentage of advanced practice nursing, providing, in these 2 main roles of clinical nurse specialist, expert clinical advice. I gave the example of a tissue viability nurse who has a very good knowledge and can provide a lot of care to patients who have maybe a wound problem. And they can provide, maybe they can do their own deep wound cleaning, they can do wound debridements, they can use vac pumps, they can use, very specialized kind of things that maybe other nurses would, need some help with. And that's what she does as well. She would train, educate, and support nurses in clinical practice to do so. So that would be clinical nurse specialist, and a nurse practitioner, as I said, is that bridge between nursing and medicine as such. But then what's the difference, I guess, when we talk about nurse practitioners between advanced practice nurses and the medical professionals? So that was another really good question. And thanks, by the way, for whoever put these questions together. They're very good. So nurse practitioners provide care and cure. So nurses, I suppose, provide care, medics provide cure, and advanced practice nurses bridge that gap. Care and cure. So from the patient point of view, it's, as Melanie was saying, it's a one-stop shop. If the patient goes to the advanced nurse practitioner or to the nurse practitioner, they get everything in one go. So it's actually much more efficient in that kind of way. And I did give you the example of the IC outreach nurse. It's really the level of decision making that is the difference as well. So it's a nurse at an advanced level who has the skill, the knowledge, and the authority to decide if a patient needs to be admitted, discharged, referred, and they can do that within the team, you know, within the limits. I'm not saying that they're overstepping anything, but within the limits, and really with the mind frame of providing timely care to the patient, providing patient-focused care, and safe, effective care within their own scope of practice, in an advanced scope of practice, and within the team that is available. So usually there are agreements on a hospital level that help that. The training and curriculum structure within Ireland, all of our advanced practice nurses study at a master's in science level, including, as I said before, 500 hours of supervised practice to achieve clinical competency. So there's clinical practicum involved. There's usually 2 modules within a master's program, 250 hours each. And the students would have to do these clinical hours, and they have to achieve clinical competencies that are at an advanced level in order to have that training complete. What competencies and skills include advanced practice nurses during the training? It's very similar to what Melanie was saying, really. Advanced anatomy, physiology, advanced pharmacology, prescribing, interventions, history taking, physical assessment, practice and service development initiatives, teaching staff, patient education, health promotion, and so on. So that's all examples for that. Our courses are 2 years part-time and master's level. And yes, in terms of specialty areas in the country, there are so many in Ireland, actually. So in Ireland, we train clinical nurse specialists and advanced nurse practitioners depending on the service need and the patient need. So I included the 2 links here. Hopefully you will be able to provide them to your students to actually click on these, and you will come to these 2 documents on the left. Basically, in those, you have many different roles outlined that tell you exactly what they do. So please do have a look at those, and it gives you a good overview of the clinical nurse specialists and advanced nurse practitioners we do have in Ireland in a variety of settings. Are there any requirements such as certification or registration for granting the work permit? Absolutely, yes. So in Ireland, in order to practice as a nurse in any shape or form, you have to be registered with the Nursing Board of Ireland, Nursing and Midwifery Board of Ireland, that's NMBI, and nurse practitioners have a special register, so they have to have the special competencies, and they need to show the nursing board that they're practicing at that level, and then they can apply to register for that as well. And they can also register as a nurse prescriber if they have done their prescribing course as part of their training. So they can end up with a number of registrations. There can be an RGN, registered general nurse, an RNP, registered nurse prescriber, and an ANP, advanced nurse practitioner, 3 qualifications at the same time. They will be all protected and all registered with the nursing board. And this is just the register there from the website that you see there. Yes, as I was saying, the number of professionals and legislation of advanced practice nursing, usually around 2%, and that's what we've been aiming for the past number of years, to have 2% of the nursing workforce in Ireland working at an advanced nurse practitioner, so it's a nurse practitioner level. We have much more clinical nurse specialists, and because we don't have a register at the moment, I can't tell you how many there are. So there would be quite a number more clinical nurse specialists that we would have working in the system, and yeah, that would be great. So all in all, the 2% relates to nurse practitioners, really. The how autonomous advanced practice nurses, as we were saying, they have prescribing rights, they have diagnostic rights, and so on and so forth. But these things are regulated locally through service level agreements, and they all need to be written out within each service, and each nurse needs to engage in that process who wants to work at an advanced level. And there's a link here where you can actually see one of those if you're interested, and that outlines everything that they need to discuss, and that needs to be signed off by the advanced practice nurse, the manager, and the medical consultant together to decide what level of authority exactly that nurse has, and by that they will work by that. So that's important to note as well. Performance for the performance of the activities, those the advanced practice nurse need supervision from another healthcare professionals. But during their training, as we said, they have 500 hours of clinical supervision, and that clinical supervision will be provided by an already established advanced nurse practitioner or a medical consultant, depending on if the service exists at that level of advanced practice nursing or not yet. So that depends. But we're moving towards a model where advanced nurse practitioners do supervise advanced nurse practitioners themselves. Is there a career path for advanced practice nurses? Yes, and it's led by the advanced practice nurses themselves. And how are they paid? I have a slide there on the next slide. There you can see exactly. So on the top there, and the third row down, you see the staff nurses starting at 30,000. This is the basic annual income. So it's what they earn in a year without weekends, without nights, without overtime. So starting off with 31,000, let's say. If you work as a clinical nurse or clinical midwife specialist in Ireland, you're starting off with 20,000 euro annually more. So there is a career path as well in your salary. And as I said, that took us a long time to get there, so we're quite proud to be there now. And as a nurse practitioner, you're starting with 59,000-ish euro per year as your basic salary with that. So there is the clerk, and that has to be like that. You know, the clinical career pathway has to be also a salary career pathway. So that's very important, and that's why regulation and education is really important to make sure that at the end, nurses who take more responsibility in clinical practice also get rewarded financially in that way. So thanks very much. Any questions, please fire away.
And we've left our contact details if anybody does want to contact us, whether it's regarding the ICN, Nurse Practitioner Advanced Practice Nurse Network, or about advanced practice in our own country.
Muito obrigada, Melanie.
Thank you very much, Melanie and Daniela. The information that you provided, they were very much, they were wonderful. Many of the questions, we have a lot of people who are watching you here with us on our channels, from the Council of Nursing and the Federal Nurse Council, PAHO Brazil, and the University of São Paulo, Ribeirão Preto. So a lot of people are asking a lot of questions. Some have been answered by you already. Among them, we still have a few. And there are a few questions like, how are the leaders of the International Council of Nurses, how you as leaders from the International Council of Nurses, we would like to know what are your perceptions about the main challenges faced to implement the advanced practices in the country, in your country, in the UK?
So I think we've talked about some of those, and it'd be interesting to see if it's similar in Brazil. So for the United Kingdom, the particular issue was around regulation and legislation. And actually, I've written a chapter in one of the Springer series books around this, which actually talks about, because the United Kingdom actually is 4 countries, England, Wales, Scotland, and Northern Ireland. Each of our countries has a slightly different way of regulating advanced practice, which makes it very complicated. But I think those were the 2 of the biggest challenges. A lot of the issues that Daniela mentioned around nurse and medical resistance are actually much less now. It is a very much an integrated role within the United Kingdom. And I've been teaching advanced practice for the last 22 years, and the numbers are just going up and up and up. So we have very much the integration of primary care nurse practitioners. It has become much more common in secondary care. And now our colleagues in areas like mental health and critical care and emergency care are very much looking at how they can integrate specialist advanced practitioners, which is coming more to the fore in the UK.
Yeah, maybe can I add to that, if just to say, I think globally, and that was one of the papers that I had kind of there on the slides as well. I think globally, we talk about the nursing workforce. If you just think of COVID or anything else, having to be mobile. We need to be able to move around as nurses, to maybe sometimes fit in where it's needed, and also sometimes to go where we need to go. So really, in terms of advanced practice nursing, we do face challenges in terms of, even if you saw the UK and Ireland, and just what Melanie was saying, the programs, the master's programs are slightly different. The regulations are different, the requirements are different. So in order for our workforce to be mobile, we have to streamline that globally. And we have not achieved that just yet. And that's quite a challenge, I think. And I think something for yourselves, if you're developing in Brazil, something to be mindful of, to maybe look at your closest countries around you and to see how you can assure that actually the registration won't be difficult. We have a lot of advanced practice nurses coming from other English-speaking countries to us, and they can't register in Ireland because it's a different model and a different regulation and a different master's program, and that just it's not very helpful. So that's a challenge for sure. So we need to globally fine-tune all of that.
Yeah, and it's really interesting, when we started our training for hospital nurses, what happened is that they often also had a placement in primary care, and a lot of the nurses then migrated to primary care, which isn't what we want. We want to make sure that we keep a consistent workforce. And that is one of the joys of advanced practice. For my hospital colleagues tell me, every 6 months we get a new rotation of doctors. The nurse practitioners and the clinical nurse specialists are there permanently. But what we don't want to do is create a system where nurses think, oh, actually it's a better salary, for example, in primary care to the hospitals, which is what we had for a long time. We had a lower salary for hospital advanced practitioners.
Ok. Obrigada.
All right. Thank you for your information. And still there's a doubt about the education process for advanced practice nurses. They require master's degree. And in Brazil, we have a professional master's and an academic master's, in which there's nothing for the practice. It's more for research. And so the professional master's that implements something of practice. And about that, for the education of the nurse practitioner, the master's is an exclusive opportunity, right, to obtain this title. And these 500 hours, how are they done? Just in theory or together with practice and theory? Is there practices on labs with real simulation, or is that the actual professional practice that is developed?
So that is the minimum of 500 hours in clinical practice. So when we started our advanced practice courses, our students were in university 1 day a week and in clinical practice 1 day a week. We have now increased that, and because we have this apprenticeship module, our students have 30 hours of supernumerary practice, so they attend university, and the rest of their practice is developing their advanced practice role. So they're employed as a trainee advanced practitioner. So yes, in university, we have patient simulation, we have practicals, but the majority of the training is in clinical practice, actually developing their skills with patients, with a clinical educator. Daniela?
Yeah, exactly. And I think this is really important for an advanced practice nursing program, a master's program. It is really important that the universities and the clinical partners come together. So there needs to be an understanding that these students will be university students to learn, to learn, I suppose within the university, different, there might be theoretical aspects like leadership and research and evidence-based practice and so on. But within Ireland, as I was mentioning earlier on, we have two modules, which we call a clinical practicum, where the students have to go out into practice to achieve their clinical competencies. And we give them a catalog. We have 5 domains of practice where they have to achieve clinical competence in, and they have to prove to the university later that they have achieved it. So we expect from our clinical partners a letter at the beginning of the program that they will support the development of clinical competencies throughout the program. So there has to be a clear working together between the universities and the clinical partners, and they need to be identified on the offset developing a program. A master's program in research will not do for advanced practice nursing. It has to be a clinical advanced nursing practice program.
Ok.
All right. Still about this issue, talking about the partnership with the clinicians who will, the clinical partners who will welcome these future students. Here in Brazil, we have a question. How do you do the professional registration of an advanced practice nurse? Is there a test that they have to pass? Is there accreditation, registration for them to obtain this title of advanced practice nurse and have a permit to work as an advanced practice nurse?
Mm-hmm. Yeah, I can go first on that. That's probably very different between the two of us. I think in Ireland, all of our nurse education is based on competencies. So within the advanced practice nursing program, we have like a competency catalog, almost like we call it the domains of practice. So there's basically skills that the nurses have to achieve while they go through the program, and that's what they need to basically show to us within the university to become their master's degree, but also to the nursing board who regulates their title. So they apply at the end of the program with this competency catalog to show that they are functioning at that level of advanced nursing practice. And equal parallel to that, they have to develop their role in clinical practice. So as I was saying, there's frameworks for how to establish the role in practice. They don't do that on their own. They do that together with the nursing manager and the consultant usually, where they develop the post and also develop the service level agreements. And all of that goes to the nursing board to show. And then in Ireland at the moment, there's a small fee that they pay annually to keep their registration up. There is development at the moment that or there has been in the past a portfolio that advanced nurses have to show every 5 years that they have kept up their competencies. So that's another thing that's kind of how it's done.
And in the UK, it's a little bit different, but we do have a competency framework. We call it an examination inventory and a portfolio where we have things like direct observed practice, case-based discussions, reflections. So the students have to pass every year. And then at the end of the course, now our apprentices have something called an end point assessment, which is a national examination, which is assessed by another university. So we have something called the Centre of Advanced Practice, where, for example, our course has been accredited. So our students go onto a national register, but that is very new. Prior to that, we had local regulation rather than national regulation.
Ok, muito esclarecedor.
All right. This information was very clarifying for us. For us, it's very important because we're starting out the path toward the advanced practices in Brazil. Between this cycle of lectures, because to us, it's very important to watch all of the advanced practices that we have in the world, in all of the countries. In a few countries, there's the need for a nurse to have an assistance practice working as nurses so that they can go on to do a master's for advanced nursing practice. How is it there in your countries? Can that person go soon after having a bachelor's degree and becoming a nurse, or does that person need to practice a bit and do some assistance before starting the master's in advanced nursing practices?
Our criteria is a minimum of 3 years post-qualification. So we want our nurses to have a level of experience and exposure in a number of areas. Our undergraduate nursing went to bachelor's, and we also have a master's degree. So if we have students who apply who don't have a bachelor's degree, we'd ask them to have done a master's level module before they apply.
Mm-hmm. Yeah, and it's similar in Ireland. We do require 2 years experience after having the training done, the degree done, basically. So that's a minimum of 2 years, and that, you know, it can be more, but the minimum has to be 2 years. Yeah.
Ok. Eu acredito que são muitas as
All right.
experiências.
I believe the experiences are many. So many things that we would like to say and hear, but our time is up and we have other commitments. So we have here in Brazil a group that does the discussion about advanced practices. And during your talk, we already heard you saying that you are available to help us implement those practices in Brazil. And we thank you so very much for that, your availability, because to us, that's going to be so important. And I open the floor now for our group if they have anything else to say. If they require any further information at this time, you can do that a little bit. Otherwise, if you don't, I will thank Melanie and Daniela so much for your availability and for being here with us today.
Obrigado.
Thank you.
Ok.
All right, then. Carla, Manuel, do you have anything to add? No? All right, so once again, on behalf of PAHO Brazil and the Federal Council of Nurses and the Collaborative Center for the Development of Research on Nursing from the University of São Paulo, Ribeirão Preto, we thank you for your availability. Thank you so much for being with us. And I'd also like to thank everyone who participated in this cycle of lectures, all of our partners. This is just the start of a great discussion of a lot of work that we have in Brazil so that the Brazilian nursing can continue doing the best and providing the best assistance for our patients and for our population, because our population requires care and the nurses in Brazil have a lot of skill and competence to do that. I'm sure that if they get to a level of advanced practice one day, we want to reach that, and we want to reach the best that we can to provide the assistance to our population. So thank you all very much. A great afternoon to all of you. And at this time, we end our first cycle of lectures, and we will be together very soon. A hug to everyone.
Thank you very much. Bye-bye.
Recording stopped.